Hey, it's Dr. Birchler here. In my practice, a couple years ago, we added what's called spinal disc decompression equipment into the office. And the reason I added that is I injured 3 discs in my back in 2020, L5, which is the bottom one, L4, which is the one above that, and then L2, which is a couple above that. And it was the most debilitating pain I ever experienced in my life. And in the process of going through that, while I had dealt with many people with these kind of things, and quite a number of them very successfully, it took longer to get better than I wanted it to. And I realized a lot of people, if they're dealing with pain for 4 or 5 months and relatively severe difficulty working, possibly missing work, they might not hang in there. They might think, something's not working, I need to have back surgery or something like that, even when something can get an outcome, which is the best in the long run, without taking the risk of surgery and those kind of things. So that's why I began doing specialty in spinal disc decompression, because of what I went through with that. And so I just wanted to mention that, but today I'm going to show you what a disc herniation looks like, both on a model and on an MRI. There are a lot of people out there dealing with back pain, pain, numbness, and tingling that radiate into their legs. And problems into the legs and feet can come from disc herniations and bulges. It also can come from joint compression, but in many cases there's a problem with the disc. And a good physical exam can tell us a lot about that. And then certainly MRI images and X-rays and things can tell us quite a bit as well. So I'm going to show you this here. This is a model of a disc. Let me see if I can flip this around here. So this is the model of a disc. So if you look at from the side, you have 2 bones. You have the spaces between them, kind of like cushions or pads between the bones. You have the yellow things, which are the nerves that are representing coming out of the spinal cord or spinal canal. And then the red stuff would be kind of like the jelly, in this case showing jelly blown out of the donut. So the disc is like a jelly donut. The clear white stuff would be like the bread, and the red stuff is like the jelly. The jelly should all be right in the center, but when the disc is injured, it can either partially tear through, or in this case, it actually blows the whole way out. And I'm going to show you what that looks like on an MRI. So the first thing is when you look at from the side, and you look at the bone and the disc and the bone, the disc should not be sticking out the back towards the nerve here. So on an MRI, if you look at this, you can see this is what it should look like here: bone and a disc, and this black stuff is the ligaments. That's normal, but this thing back here, this thing that's sticking out, that's a disc herniation. The disc is blown out there. That shouldn't be like that. And then if you look from the angle like so, you'll see that disc is going back towards the yellow things, which would represent the nerves coming down the spinal canal, and then they're going to come out one side or the other and go down into the legs, form part of the sciatic nerve, or other nerves going into the thigh or things as well. So on an MRI, this is what that should look like. You should see kind of like the disc in this case would look black on the MRI, and then you have a space and there are nerves in there. So this is actually what it should look like there, but if we go down, you can see this stuff here. That's the disc herniation that's sticking out. So it's kind of like the jelly has come out of the donut on that side, very similar to that red goop here that looks to be like the right of the screen. It's very similar on the MRI. Now these little black things would represent the nerves that are coming by that disc. So it's going to be inflamed, and around those nerves, they're going to be irritated, causing pain into the buttock or the leg. Could go all the way down to the foot, depending which nerve is being affected. Can certainly cause back pain and things as well. Now this kind of thing, the large majority of people with something like this will be able to get better non-surgically. However, just moving the bone often won't cut it. You have to have some kind of mechanical force that gets that kind of jelly to suck towards the center, and that's the point of what's called spinal disc decompression. So I thought this just might be interesting to somebody, or helpful to somebody if you're dealing with disc herniation, disc bulges, things, even if you're not sure if what the right path is for that. Come talk to us about that. If it's something we can help with, we will. If we feel strongly that you need to see somebody else or another type of doctor for that, we can give you guidance on the route to go as well. And if you're not sure what's going on, you haven't had MRIs, you haven't had done testing, we can give you guidance and or order any necessary tests to really define why you're having trouble, possibly why you haven't gotten results from other practitioners or other things you've tried to do to get better.